we have Dr. Ozsivadjian presenting on cognitive pathways to mental health problems in ASD.
Okay. Oh, thank you. Sorry, I was waiting to change presentation. I'm going to continue on the theme of complex presentations, thinking particularly about co-occurring mental health problems in autism spectrum disorder. So it's a bit of a whistle-stop tour, really, of where we were, where we are now, and where we should be going. So where we were when I started in the field about 14 years ago, and really for quite a few years after that as well, anxiety and emotional disturbance were frequently conceptualized as part of ASD, and really it was around the time pretty much that I qualified that people were really beginning to think about whether these were separable, co-occurring difficulties which required separate treatment. And as Marinos said, the treatments for core symptoms of ASD aren't brilliant or non-existent sometimes, but in terms of the co-occurring problems, we have some reasonably good treatments now. And mental health problems underlying challenging behaviour were also frequently unrecognised or misunderstood, which can lead to mistreatment as well, of course. So if somebody is acting up or presenting with very challenging behaviour, they might be treated with medication when actually there might be some environmental reasons or mental health reasons driving that behaviour, such as anxiety. And then really we had few, if any, treatment options other than medication. But since then, the story's changed a bit. So I think where we are now, we certainly have robust data on the prevalence of mental health problems in autism spectrum disorder. So I'm referring to Emily Simonoff's paper there, 2008. There's been several since as well, but this is one of the seminal papers showing the greatly increased rates of mental health problems, in particular anxiety. Several trials we have now demonstrating the efficacy of CBT for anxiety. I've just cited one paper there, which there's some meta-analyses been done because there's so many trials now, using various methodologies, and I'll talk a little bit more about where I think we're going with treatments at the end. I think we have a better understanding of the typical and atypical presentation of anxiety and depression to a degree, and OCD in this group as well. And I think this slide is not quite all on the screen, because there should be 5 points on the slide. We've developed some ASD-specific assessment tools. So one of the conversations that used to be had among clinicians was, oh, measures, they don't really capture it, do they? And, just in the past couple of years, really, some people have begun to develop some measures which really capture the atypical presentation of anxiety in this group. They're not yet widely available. One is a questionnaire measure, which is available online, and another one is a interview measure, which is excellent, and I hope will become more widely available. And there is one more point on that slide in terms of where we're going. And anyway. So, actual. Come back to that one. So, I think in fact that was it. It was cognitive pathways to anxiety in this group is another thing that we're beginning to understand. So not just the fact that mental health problems have a much higher prevalence in this group, but we're beginning to understand a little bit about why as well. So why is it that people with autism have such preponderance to anxiety problems, for example? And it's not just a little bit of a raised prevalence, it's a lot. We're talking figures of 40, 50%. Some studies have found 70 to 80% prevalence rates of anxiety in this group, compared with figures of 5 to 10% in the general population. And those figures are higher than in the children with language impairment or conduct disorder, various other groups of children with neurodisability. But there's something particular about autism which seems to lead to a particular preponderance in anxiety. I started my talk by saying I'm going to be talking about mental health problems. A lot of the research is on anxiety, so I will be focusing quite a bit on anxiety. So what we have found, what we do know now about cognitive pathways to anxiety and autism spectrum disorder, there's some fairly robust relationships between intolerance of uncertainty and anxiety, executive function and anxiety as well, and also attentional bias and anxiety. So I'll talk about those each. So thinking about attentional bias then, so this is a process which has been commonly implicated in anxiety disorders. in the general population. There's only been a few studies which have looked at it in autism, but what's interesting is that not only do you see as you would expect in children who are anxious, an attentional bias towards threat information in people with autism, but even people with autism without anxiety tend to have a greater attentional bias to threats than people without autism. So it's almost as if there's something about the makeup, the cognitive makeup of people with autism that sort of predisposes them to have an orientation towards threat. So 2 studies there have found that relationship. So looking at the one above, autism and anxiety had similar rates of attentional bias compared to a group of children with no autism. And then looking at the next one there as well, threat faces, similar sorts of findings. So intolerance of anxiety was the next thing that I was going to focus on. And again, it's a small but robust literature looking at the relationship, or possibly causal relationship, between intolerance of uncertainty and anxiety. Intolerance of uncertainty being exactly what it says it is, an intolerance of uncertain situations, and closely related to the difficulties of change in routine that we see in this group, the insistence on things staying the same. And studies have found, for example, a direct relationship between a greater insistence on sameness, which is associated with higher anxiety. So just looking at questionnaire measures, finding a correlation between the two. And that led the authors to think about whether repetitive behaviours have a different function in this group, which may not just be about emotion regulation, as people have previously thought, but also maybe it's about creating sameness. So, you know, when you're engaged in a repetitive behaviour, you know what's going to be happening as long as you're doing that in repetitive behaviour, if that makes sense. It creates a sort of sameness, which can then lead to positive beliefs about repetitive behaviour, possibly reducing learning opportunities. And there's another study found that comparing a group of children with and without autism and the anxiety, they found that the anxiety was almost completely accounted for by intolerance of uncertainty. So when they took out the intolerance of uncertainty variable, there was very little difference between the groups in terms of anxiety. So suggesting that in autism, that may be a particular cognitive pathway from autism to anxiety. And are we looking, though, at more than just intolerance of uncertainty? Is there intolerance of all sorts of things in this group? So, for example, an intolerance of discomfort, intolerance of their internal state. So, for example, people may have worked with people with autism who get excited and then that tips over into anxiety and they can't cope with the sort of arousal that comes with excitement. Or, for example, when you're talking to children about things which might cause them embarrassment or shame, and then they start acting in a challenging way because they just can't tolerate that feeling. Or again, is it intolerance of external stimuli as well? So the sensory difficulties that we see, the difficulties again with change. So recently, there's been a great proliferation of interest in emotional regulation. So emotion regulation being an emotional response emotional response requires emotional regulation, and emotional regulation is defined as the effort to then modify or control your response to that emotional reaction. So usually focusing on a particular goal. And adaptive emotion regulation strategies would involve things such as reappraisal, problem solving, but emotional dysregulation may present as meltdowns, irritability, aggression, self-injury, impulsivity, depression or rumination, avoidance of difficult emotions, and of course anxiety. And there's some studies now which have shown that individuals with autism use adaptive strategies, such as cognitive reappraisal, less frequently, and maladaptive emotion regulation strategies, such as avoidance, more frequently in the management of negative emotion. And there may also be a rigidity there, which is once there is a strategy that someone feels comfortable with, then they revert to that strategy all the time. There may be a failure to learn more adaptive strategies, which poses a challenge for the therapist. And so Susan White and colleagues have proposed 2 pathways to anxiety via impaired emotion regulation, which I shall show you in this model. A direct pathway from autism to anxiety via impaired emotion regulation, and then a less direct route via moderators, including attentional bias, which we just discussed, other information processing difficulties such as rigidity, social motivation, social confusion, etc., which can basically make the anxiety worse or better. And this is another way of conceptualizing emotion regulation difficulties in this group, which places the emotion regulation in the center, in a sense. So it's a different way of thinking about it. So thinking about, at the bottom there, psychiatric conditions feeding into emotion dysregulation. It's kind of almost like a cyclical relationship, not just emotion regulation causing psychiatric difficulties such as anxiety. It thinks about how the information processing difficulties can feed into emotion dysregulation, and cognitive factors, which we talked about a little already. And also then thinking at a brain level as well, and I'm going to spend very little time talking about this, but how there may be something different at a neurological level which causes anxiety problems in this group. So for example, one study has found that there's a reduced heart rate and cortisol response to psychosocial stress in people with autism, which is a pattern which is quite similar to people who have experienced chronic stress, a sort of PTSD type response, including early childhood maltreatment, which is interesting because it suggests that it's almost as if the world is quite a stressful place right from birth, and actually dealing with that stress leads to this altered physiology which produces a different response to anxiety. There's also some research at the sort of structural level, looking at abnormal prefrontal cortex function and also abnormal connectivity between the prefrontal cortex and the amygdala. So the amygdala being the part of the brain which actually generates and moderates emotions, the frontal cortex obviously being the part of the brain which helps us to organize ourselves, helps us to plan, helps us to think about what we're doing and what we're thinking and feeling. And if those two parts of the brain aren't communicating with each other, then you can see how there might be some dysfunction there. And the role of cognitive rigidity is something that's been talked about, but not researched very much. But there's lots of thinking about how rigidity might lead to mental health problems in this group. Rigidity may in fact lead to intolerance of uncertainty, because if you're rigid and you want things done a certain way, and then you're faced with uncertainty, that might cause you some anxiety. Rigidity can inhibit the development of flexible, adaptive strategies to managing stress. As I mentioned, people may have one go-to strategy, which may be, I hit my mum when I get stressed. It might not be a conscious thing, but that might be what happens. And there may be a bidirectional relationship between rigidity and anxiety. So people who are getting anxious may then become more rigid, and then resulting in insistence on sameness, as well as rigidity preventing the effective management of anxiety. The role of alexithymia has been discussed and received a fair bit of interest recently as well. Alexithymia being characterized by difficulties identifying, expressing and feeling emotional states. And there's been some proposals that the emotional impairments, such as impaired emotion recognition in others and reduced empathy seen in autism, might be the result of co-occurring alexithymia. And the relationship between anxiety and features of ASD has also been shown to be mediated by alexithymia. And in fact, a lack of reactivity to inner experiences was found to be a powerful predictor of anxiety and worry in adults with ASD. So again, most of these studies are finding very significant relationships. And so people have been trying to explain why then. Why do these things cause such great anxiety? I think it's been nicely summarized in this model here, whereby atypical sensory function and alexithymia, which are highly related, in fact, atypical sensory function may lead into alexithymic type difficulties, and then rigidity there as well, which all feed into the intolerance and uncertainty, which may lead to the restricted, repetitive thoughts and behaviours and anxiety symptoms that we see. So where we are now, I was talking a little bit about treatments. Adapted CBT, as I mentioned, there's been lots of trials showing the efficacy of adapted CBT for this group. A lot of the trials have adopted group approaches, but now we're seeing more studies involving individual approaches as well. So adapted CBT would involve using lots and lots of visual supports to support your communication and to support their communication and understanding of the concepts. It also reduces the social pressure. So if you're using a whiteboard or you're using various visual sort of supports, there's less of a pressure to interact and have that conversation and make eye contact, etc. Adapted CBT may include enhanced emotion recognition training, and you may want to involve regular breaks to take into account attentional differences, closer involvement of parents, which I think is key, both directly in therapy and to address systemic factors as well. And you may want to include overt reinforcement for engaging activities such as behavioural experiments, really simple sort of reward strategies to encourage things there. And then mindfulness-based cognitive therapies. There's very few studies, but what there are suggesting that this could also be a very effective treatment for this group and nice alternatives to CBT, which doesn't work for everybody. And it enhances an awareness of inner experiences, so addressing those alexithymic difficulties without attempting to change them or judge. So there's also several studies on mindful parenting for ASD as well. So where I think we're going, there's still a lot of work to be done in terms of understanding the risk factors and also variation of expression of mental health problems in this group. Certainly anxiety has received a lot of attention. Depression is beginning to receive a fair bit of attention, but I'm wondering if in the same way that anxiety was overshadowed by autism, depression is almost being overshadowed a bit by anxiety. And I quite often find when I'm treating people, the depression is secondary to anxiety, as in living with anxiety so difficult that it can cause low mood. But it's also making me wonder whether or not, because anxiety can be so overt, whether that's overshadowing slightly more difficult to detect depression symptoms. We're heading towards wider availability and standardization of autism-specific assessment tools. And also we could be moving towards the development of objective measures involving physiological measurement as well. We are moving towards research-informed interventions. So for example, CUES, which is a CBT focusing specifically on intolerance of uncertainty. Imagery-enhanced CBT, imagery being one of my pet subjects, and that's a separate talk in itself. And also particularly interventions targeting rigidity. There's no evidence for this at the moment, but certainly in the eating disorders population, cognitive remediation therapy is receiving some attention. And then we could also, I think, do with some trials comparing treatment approaches, identifying what works for whom, and particular medication and CBT as well. And that's a big hole in the literature at the moment, I think, for this group.